This is Dr. Rajni Mandel with Pathology Watch, here with your 3D 3-minute digital dermatopathology digest. Today's topic is epidermal inclusion cyst. An epidermal inclusion cyst is a cyst with epidermis-like lining with a granular layer. Here you see the cyst here in the dermis. Sometimes there is connection with the overlying epidermis, known as a punctum. The lining of the epidermal inclusion cyst has a granular layer at the surface. The lumen of the cyst is composed of basket weave or onion skin keratin. The differential diagnosis of cysts includes a pilar cyst. A pilar cyst does not have a granular layer and has compact keratin within the lumen. If you notice here, there are no adnexal structures within the wall of the lumen. If you had sebaceous glands or hair follicles, this would be a dermoid cyst. If there were small hairs in the lumen, this would be a vellus hair cyst. Epidermal inclusion cysts can get inflamed, as seen here. This is one pattern of inflammation. Please disregard the yellow inking as that's due to processing. The wall, as well as the surrounding area of the cyst, can have a different inflammatory infiltrate. Here is lymphocytes and plasma cells, and sometimes you can see neutrophils. The inflammatory infiltrate can be quite dense and extend to the surface, where there is irritation and parakeratosis. Another inflammatory pattern of epidermal inclusion cysts is the granulomatous response. Here, the cyst lining has been completely replaced by a granulomatous infiltrate. You can see here multinucleated giant cells as well as lymphocytes, and if you're lucky, within the cytoplasm of a giant cell, you can see wispy keratin fibers. So here are your 5 flashbacks for epidermal inclusion cyst. This is a cyst with an epidermis-like lining with a granular layer, as opposed to no granular layer, which can be seen in pilar cysts and steatocystomas. There are no adnexal structures, opposed to adnexal structures seen in a dermoid cyst. There's a basket weave onion skin keratin fibers within the center and lumen of the cyst. This is opposed to compact keratin seen in pilar cysts, and if there are small hairs in the lumen, it's a vellus hair cyst. They can be inflamed with a granulomatous response, and multiple cysts are associated with Gardner syndrome and Gorlin syndrome. Here's a bonus review question for today. A 50-year-old male underwent colonoscopy which revealed multiple polyps in the colon. The patient has a family history of colorectal cancer. What dermatological findings would support the diagnosis? A. Steatocystoma, B. Epidermoid cyst, C. Neurofibroma, or D. Basal cell carcinoma? The answer is B. Epidermoid cyst, and the description is that of Gardner syndrome. That's it for me. This is Dr. Rajni Mandel from Pathology Watch, revolutionizing pathology for dermatologists. Visit us at pathologywatch.com.